Hello, hello. Can you hear me? Is that working, Anna? Is that okay?
It's running, a colleague can hear it.
Oh, fun. Okay. Welcome, everyone. I'm Councillor Matthew Willington, Cabinet Member for Community Wellbeing, Health and Care, and co-chair of the Health and Wellbeing Board. Limited public seating has been made available. However, this meeting is also being webcast to allow the public to attend remotely if they so wish. If the continuous fire alarm sounds, please evacuate the room and public gallery by the stairwells. Do not attempt to use the lifts. Please assemble in Guildhall Square by Queen Victoria statue. In order to comply with the Guildhall Trust fire marshal regulations, anyone who signed in at Guildhall reception desk should sign out when leaving the building at the end of today's meeting. May I draw everyone's attention to the fact that this meeting will be live streamed. Everyone speaking via a microphone will be on camera, including those making deputations, though we don't have any. Members of the press and public are also permitted to record the meeting on the understanding that it neither disrupts the meeting nor records those stating explicitly that they do not wish to be recorded. Please, can everyone use the microphones? You can bend them towards you, nice and easy, and you can pull them towards you as well. You've got your leads. And remember to turn them off when you finish speaking. We've read the report, so presenters, please only highlight any developments that have occurred since publication. Finally, I'd like to welcome James Stewart as the new chair of Portsmouth Education Partnership and to thank the previous chair, Frances Soul, for her contribution. So if you just do introductions starting to my right.
Anna Martin, Democratic Services.
Good morning, I'm Sue Gale, I'm the Head of Community Integration at Probation.
Hayden Gins, Children's Services, representing Sarah Daly.
Councillor Steve Pitt, Leader, Portsmouth City Council.
Councillor Graham Heaney, Deputy Leader of the Labour Group. Morning colleagues, Andy Biddle, Director of Adult Social Care.
Morning, Helen Atkinson, Director of Public Health.
Good morning, David Goosey, Chair of the Safeguarding Adult Board.
Lorna Reevely, Chief Officer of the Hive Portsmouth.
Good morning, Ron Shields, Chief Exec Hampshire and Argo at Healthcare.
Good morning, Jason Oakley. I'm the University of Portsmouth representative.
Good morning, Roger Batterbury, Chairperson, Healthwatch Portsmouth.
Good morning, Dr Linda Colley. I'm a GP and I'm Clinical Director for Portsmouth Place for NHS Hampshire and Isle of Wight and co-chair of this board.
And Kelly Nash on Strategy at the City Council.
Phil Foxton, Hampshire and Isle of Wight Fire and Rescue Service.
Thank you very much. Welcome, everyone. So item 1 is apologies for absence. So far we have absences from recorded from Bernie Allen, Hampshire Isle of Wight Integrated Care Board, Sarah Beattie, Probation Service, colleague there, and we've got colleagues from the Integrated Care Boards here today presenting. Sarah Daly, Children's Family Education, so Hayden's here for that. James Hill from PCC, Penny Emmerich from Portsmouth Hospitals, Superintendent Paul Marker from Hampshire Police, Gemma Nichols from Portsmouth Creates, Diane Charlotte from AGK, and Steve.
Councillor Nick Dorrington, who messaged me this morning to say that he's got a family member who's seriously ill in hospital and he's had to cancel all of his appointments today.
Okay, thank you very much. And Anna?
A couple more since that was printed.
Okay.
That's Natalie Brahma Pearl, Chief Executive, Portsmouth City Council, Joanne Shankland, City of Portsmouth Colleague.
Thank you very much. Appreciate it for that. Any declarations of interest? No. I'm just going to take this point today because for the members in the room, so that'd be myself, Steve and Graham, it is within a pre-election period as we have a by-election in Paulsgrove in the city. So it's just about a warning that if anyone makes overtly political statements from the elected members, then I will have to suspend the meeting. I'm sure we can control ourselves today. But yes, that was an agreement to make sure this meeting went ahead, that I could do that. So I have said my piece. I will restrain myself. I'm sure the other two will as well. Minutes of previous meeting held on the 25th of June 2025. I presume everyone has read them, so we've read the reports. Were there any comments on those at all? Everyone happy with them? Excellent. Okay, so item 4, and one of the reasons why I really want to make sure this meeting went ahead, because I know David couldn't make the next meeting of this board, so so we've got the Portsmouth Safeguarding Adults Board annual report. David, the independent chair, over to you.
Thank you. So it's my privilege, my responsibility as chair to present this report to you. I think it's not or shouldn't be seen as a report simply about documents, policies or data, but it is about stories of people's lives in Portsmouth, of the risks that they face, the lessons that I think we've tried to learn from those experiences. And I think first, very much importantly, is the story of partnership working. I think the report also demonstrates the volume of work that's gone on in the board over the past 12 months. I want to highlight a few things, if I might, Chair. First of all, I think the personal stories in the report are really, really important. Last year, the board published 2 serious adult reviews, one for Mary, one for Miss Kay. Both young women in their 30s, both loved, both dreamed, but sadly both essentially fell through the gaps in services. In Mary's case, assessment delays, a lack of continuity, and missed opportunities meant that her needs went unmet. In Miss Kay's case, I think the, again, hidden homelessness, coercive control, fluctuating mental health needs also meant that she remained, largely speaking, unseen by the system. And I think their lives remind us, I think, that safeguarding is not simply an abstract process. It isn't simply about data. It is about dignity. It is about compassion, and it's about the action that together we can make a difference with. The second thing I think I'm really, really proud of is the work of the engagement subgroup. We set out a few years back to really try to reach some of those communities in Portsmouth that hitherto remain untouched. And the group set about meeting with various community groups in Portsmouth, a men's group in Paulsgrove, a cross-cultural group for women, group for people with mental health difficulties, and so on. And what they heard, I think, in those meetings was sobering. People understood the need to safeguard people from harm, but they didn't necessarily understand what to do about it. And I think, therefore, the work of the board in terms of not only raising awareness about safeguarding, but also ensuring that safeguarding is visible and it's accessible and people know what to do. It's rooted in community life in Portsmouth, really, really important. Thirdly, self-neglect continues to be a key issue in Portsmouth, as I think it does across the country. Over half the concerns raised were about adults under 65 self-neglecting. And most of those were at home behind closed doors. Most were only coming to light when somebody went into hospital, for example. Staff have told us that sometimes they don't always have enough time or the resources or the specialist services to meet the needs of those people. So our message, I think, is clear. We need to do much, much more to act earlier, to give frontline workers the tools and the confidence to respond. Fourthly, again, a real celebration in my perspective to celebrate partnership in action. As a result of some of the serious adult reviews that we've done over the years, at Portsmouth Hospital, the multi-agency safeguarding and support team has done some brilliant work in ensuring that vulnerable homeless adults who are being discharged from hospital are not sent back on the streets. And I think this is a really important project. Project W also came out of serious adult reviews, particularly around Miss K, but also Kim, which was published the year before, offering women-only spaces for women with mental health and substance misuse difficulties. A project promoted by Public Health and a demonstration, I think, of the partnership working that goes on around this table. And I think that these examples are very much born in this room about the ways in which people collaborate with each other. I sit across a number of different adult and children's partnerships in the country, and I can say honestly with my hand on my heart, and I think I've said this before, this is the best performing health and wellbeing board that I sit on. Finally, thinking about some of the numbers, 3,300 safeguarding concerns were raised in the city over the 12 months in question. 94% of those cases where risk was identified, it was reduced. In 94% of those cases, people told us that we'd made a difference to their lives, that their goals had been met. I think that's a real celebration. And it's about partnership in action. So I commend the report to you.
Thank you very much, David. Any comments or questions? You stunned them into silence, David. Thank you so much for the report, and thank you for the work you do and your team on the safeguarding board, and everyone who's on the board. I have the fortune of sitting on there myself, and I know how the fantastic work they do, and I think the report is really reflective, and David's right, it's about people, it's not about numbers in the end that we're involved in. And I think it's, as we always say, and we say at the board and we say elsewhere, and I know I say that in my day job as well when I'm working with VCSE organisations around in Hampshire, safeguarding is everyone's business, and the less that we have people who say, I don't know what to do about it, the better. And I think that's there's been developments in the last year which reflected in the report, which I think is helping people have the confidence to know what they do when safeguarding things happen, but also to lessen safeguarding issues as things with like MAST and Project W, which I think is a really important part of that. So as these things are always reflective because they're looking backwards, but they're actually also looking forwards because it shows us that we've got things we have done, but it's also that there are things we need to do better. And I know there's work going on at the moment, in particular around how we can work better together as well within statutory services. And there's actually there's an exercise going on at the moment as we speak. So I know that that's one of the areas that really taking forward, and one of the reasons behind that is the safeguarding issues. Steve.
Just on the specific issue of self-neglect, particularly in the under-65s, colleagues will have heard me say before many times that early help and intervention can save an awful lot of money down the line and save an awful lot of distress and poor outcomes for individuals. And we often talk about causes of the causes. What are we identifying around those issues that we might be able to do more to address to reduce the incidence of it occurring in the first place?
That's a good question. I think if we look at the policy landscape in respect of safeguarding adults, the Care Act goes so far. The responsibilities of health organisations only goes so far, and of primary care too. In a sense, I think to really get at what you're describing, we have to engage the communities much, much more. It's about people, not just services. Quite often when it comes to self-neglect, some people do know about folks who are self-neglecting, and the question really is, how do we mobilise them to do more? Because services will never stretch sufficiently to be able to cover every instance where an adult is self-neglecting. So, as I said earlier on, the work of that subgroup on engagement and really working through as many communities as we can to empower them to notice more and to bring to the attention of those people that need services. I think that's the key.
Thank you. I think I'd add to that as well, Leader. I think we're very good in Portsmouth at acorns, I think. We try not to erect too many oak trees, but we do try to plant a few acorns. And I think one of the things we're working on at the moment, in conjunction with colleagues in VCSE, is community help desks. Because we're acknowledging, and this was from some research that Healthwatch did last year, that some people are excluded digitally. They're never going to contact us in the ways that we're increasingly moving to. And so thinking about those people that know people in the communities, we think the community help desk could be part of that in helping us to understand that and work on that prevention. We've also championed and continue to promote things like our independence and wellbeing team, who go in, connect with people, work with people on their level, however much work they're prepared to accept, and try and connect them back into their communities. A lot of this is about isolation and not necessarily having the example of other forms of living because those folk are isolated. So I think there is quite a lot on prevention. We can always do more, but I think the community help desks, and if we can achieve our ambitions and think about how we go into hospitals and that kind of thing, could really make a difference for people too.
Thank you. Did you want to come back, Steve?
Yeah, I'm just wondering, I understand what you're saying and appreciate both your answers, but I'm just thinking, are we doing any mapping around the incidents that we are uncovering to see whether, for example, it would be probably quite a lazy thing to say, but not an inaccurate thing to say, in the instances of self-neglect post the age of 65 can often be linked with a decline in mental well-being and potentially onset of dementia, Alzheimer's, etc., people not even being aware that they're self-neglecting. Whereas in younger age groups, are we seeing that this is predominant in people who are experiencing mental health issues, people with learning disabilities, people who perhaps have been an only child living with a parent who may have been very dominant in their life and has passed away, and therefore they have no ability to self-care? Because knowing who the people are that fall into each category would help us to better identify where interventions might be necessary. I've, from personal experience, had a family who were friends of ours, and the mother passed away at late 70s from cancer. Her son had only ever lived with her. He had never cooked his own meals, done his own washing, ironing, changed the bed, nothing. She did everything until the last few weeks of her life. And he needed support, not because he was suffering from any learning disabilities or mental health issues, just because he didn't know how to live. And it was a relatively simple intervention. It took a few months to get him into that situation where he's able to do that for himself. But that's because that was known and he was part of a community. Without that, he probably would have ended up as one of those statistics. So I just think identifying the who and understanding that is a key part of this. And are we doing that?
So I don't think our systems are sophisticated enough to do that mapping currently. I think we tend to depend on intelligence from all of the organisations that we're connected to. So that example that you give, and I take the point about the gent in question not having a learning disability, but those kind of scenarios often do come across our desk in terms of folk with a learning disability who are being cared for by their parents. We have referrals from all over the place as a local authority, I think, not just into adult social care. We have the transition pathway through children's social care. So when we're aware of, when we see that intel, I don't think we're organising that on the basis that you talk about in terms of mapping. I don't think we've got the sophistication in our systems. So I think we still do depend on intelligence to find out about folk from all over the place. I mean, our fire and rescue colleagues, our police colleagues make referrals into our services. So we do pick people up, but that very clear mapping, I don't think exists currently.
I'm just going to bring Linda in and then I'll come back to you, David.
Yeah, no, I agree. And with the neglect, it doesn't surprise me that it takes them going into hospital for it to be found, because by definition, they're not going to present to primary care because they're neglecting themselves. And so I just wonder, when we're developing our neighbourhood teams, and we very much focus on frailty, which often think of age, we probably just need to make sure we're building in those under 65 pathways to make sure the integrated neighbourhood team are, because there's good discharge planning between our neighbourhood teams now and the hospital. How do we make sure we're picking up that cohort and really looking after them at that stage?
Back to you, David.
This isn't about mapping, but it is about looking at the lives of those people that we do know about who've self-neglected. And they've nearly always got a long tail of activity that probably starts in childhood. It starts with fractured relationships in childhood and ends up with social isolation, which we've talked about in this room before. And stuff gets in the way, mental health issues, breakdowns of relationships, substance misuse issues, domestic violence. They're all things, in a sense, that also creates stigma. And I think it's easy for us to see the frail elderly person and to feel sorry for them and to want to help them. But there are some people in these circumstances who are self-neglecting who people walk away from. And that tackling stigma, I think, is one of the biggest things that we have to think about. And it's really, really difficult to do, because your human response quite often is to denigrate. And what we've got to do is to equip our staff to think differently. And I say that in terms of staff across all services and all systems. It's that stigma. And this came out when we were looking at the analysis of serious adult reviews across Hampshire and the Isle of Wight. We defined it as the proceduralisation of stigma. There is a sense in which, for some people, when they connect with services, they're often bounced off because of stigma. It's almost as if the system itself labels them as such and therefore doesn't help them. That's a real difficult nut to crack, I think.
Linda.
Yeah, sorry, and I just want to mention that I went to a trauma-informed workshop. Hayden, you were there as well, and it's exactly that type of workshop is trying to tackle, really making us aware that the behaviours are one thing, but what's led to those behaviours and getting the staff upskill. I have to say, it was a fantastic day of education. It's how we roll it out to more people, I suppose. And then for me, as a GP, how do I take those lessons and put it into my 10 or 15-minute appointments, and how do you do it in practice? But it's that kind of thing that was trying to tackle.
Thank you, everyone. Really good discussion, and I think it just brings home to the fact that we are dealing with people who are individuals who have needs, and that's where it all comes down to. So whatever we're doing, when it comes to safeguard, it's everyone's business, but it's also everyone's business. It's also everyone's. It is everyone who's involved in safeguarding, whether you're noticing it or trying to do something about it, or whether you are someone suffering from things that needs safeguarding support as well. So it's but thanks again for the report. So we had and of course what David hasn't mentioned is we have the Safeguarding Out of the Walls conference on Friday. So, which I'm really looking forward to going to. And again, that is a really key part of what the board does in bringing everyone together. I think when we've had them in previous years, they have been incredibly successful. I'm really pleased that we have those on, and they are open to everyone who wants to come along. And it will. I'm really looking forward to that, and more discussion about these issues that we've just been talking about it being everyone's business, and as you said, David, about self-neglect in particular, which I think is something we have to do more work on. Okay, so moving on to item 5, the pharmaceutical needs assessment. I can see Matt approaching, and we've got James as well, or is that Phil? James, yeah. Okay, fantastic. Over to you both.
Thank you, Chair. Matt Gummerson, Assistant Director of Public Health. And, Jim Hawkins, Public Health Principal Intelligence Analyst. So here to introduce the pharmaceutical needs assessment. I brought Jim along because he's very much led the process from start to finish this year, so I wanted to publicly record my thanks to him for his excellent work on this year's P&A. I think most of you are familiar, possibly too familiar, with the pharmaceutical needs assessment over the years, but just for the benefit of any new members, just to remind you, it's a statutory duty for the Health Wellbeing Board to publish pharmaceutical needs assessment every 3 years, so it needs to be published by the 1st of October 2025. The draft pharmaceutical needs assessment came to this board in March prior to the consultation, and the findings of the P&A haven't changed in light of those responses to that consultation. So I don't intend to go through the P&A in detail at this point, but just to highlight that those conclusions remain the same, which is that with 32 community pharmacies, including 3 72 to 100-hour pharmacies, 1 distance selling and 1 dispensing pharmacy, that we believe that the provision of pharmacies in the city as currently provided meets the needs of the Portsmouth population. Section 4.3 of the report details the consultation responses. We had 5 responses to the consultation. They were all largely positive in terms of supporting the findings that the P&A reflects the current provision of services and provides the information needed. There were a couple who disagree with that statement but didn't provide any additional information that we could respond to. There was a more detailed response around section 6.1 in the P&A, just highlighting some ambiguity in the wording around late evening and extended weekend coverage. So we're grateful to Healthwatch for their detailed response to the consultation, and we have amended that section to just clarify that, hopefully to address that point. So the last thing I'd just highlight, the P&A is a snapshot at a point in time, and the majority of the analysis work for this was carried out earlier in 2025, prior to the publication of the draft in March. There is updated data analysis always available on most of these things in the Joint Strategic Needs Assessment, but the document reflects the position at that point. And we have just provided a link to the NHS Find a Pharmacy website where you can get the latest supplementary hours. Those can change at quite short notice, so we don't use them for assessing provision, but they're all available on that link if people want to access that in more detail. So really just asking the Health Wellbeing Board to approve the final P&A as set out in Appendix A.
Thank you, Matt. Any comments or questions? No. Thanks very much to both of you for this today. Thanks, Jim, for your work on this. It's something we have to do. The fortunate thing in the last year is there has been no change. So we've had, I think, no requests for mergers or any requests to close a pharmacy. So actually, this year it's been very straightforward compared to previous years. So this is our one sort of decision that we have to make at the meeting. So is everyone happy with recommendations? I'll just read it out. The Health and Wellbeing Board is asked to approve the final Pharmaceutical Needs Assessment 2025 as set out in Appendix A. Is everyone happy with that? Oh, Helen.
I just think it is important, completely agree, obviously, but it is important to note that, before you know I wouldn't do that to you either, but it is important to note that 2 years ago, as we were coming out of COVID, and obviously with the cost of living crisis, we were very concerned about pharmacies, and we did have there were some national closures in the supermarkets, but we also did have some, 2 or 3. And I think it's important to note, and I'm sure Phil would agree with me, how important the community pharmacy infrastructure is in terms of health and care. And I think sometimes we forget that. So it is really important that they are there alongside our primary care colleagues, offering support. And there's some really good national advertising at the moment that people can go and get, they can get advice. And of course now, because we've got pharmacists who are prescribers as well, they can actually get treatment. So I think it's really important, particularly as we're going into winter, which is why the advertising is out there now to remind people. So I think, because it was in all the risk registers, I think we should just, again, which is what you've said, be relieved that what we were worried about hasn't actually come to fruition.
Thank you, Helen. Yeah, I think it's we shouldn't underestimate that we're in the fact we haven't had anything happen in the last year is actually massively positive. So it's it means that this is very easy for us to sort of go through, but also it's the fact that because at one point it was looking like we were going to have mass closures ongoing, and that hasn't happened. So I think we hadn't quite agreed it because Helen came in. So is everyone happy? Yeah. Excellent, excellent. Okay, thank you very much, both of you. So we move swiftly on to item 6. Caroline is with us for community safety updates. Over to you, Caroline.
Good morning and thank you. And I'm going to be presenting Paul Markham's paper for him in his absence today. So obviously this is for information only.
Can you just introduce yourself, Caroline?
Apologies. Most people know me. I'm Caroline Hopper, Corporate Projects Manager, and I'm the Strategic Lead for Community Safety, Violence Against Women and Girls, and some other bits. So this is a full information paper. As you're aware, we now have a strong community safety subgroup that is supporting the community safety functions of the Health and Wellbeing Board. And we've been progressing on a number of work streams around the priorities that you approved earlier on this year, and doing some operational work as well to support those structures. Alongside this, we've identified, and that's the primary purpose for bringing this paper here today, a growing issue around cybercrime, online safety, digital. It is something that came up in our community safety survey last year. It has previously been a priority of the community safety plan, particularly post-COVID, when we did see an increase in activity in the online space. There was roughly 1,400 cybercrimes reported at our last strategic assessment, 23-24. That is now going to be in the region of 1,900 when we publish the updated assessment, then it comes to you in November this year. So you can see this is a growing issue. It was one of the largest reported crimes in the 2024 Community Safety Survey. But still many, many incidents are going unreported. Now, whilst we absolutely see this as a squarely landing in the positive relationships space, digital and the impacts of cybercrime obviously are cross-cutting against all the other priorities in the Health and Wellbeing Board. You know, we do see trends around financial scams disproportionately affecting people who are experiencing poverty and housing instability. We do see the link between harmful online content and the impacts in our education system and children's mental well-being. So we are seeing concerning trends around how online content is shaping perceptions and how that is then playing out in physical environments. So really bringing this update to you today is a chance to start that discussion about how we are addressing that digital space collectively together, not just from a community safety perspective, but how we're coordinating our efforts, because I'm sure in many ways we're already single agencies doing work around this. It's also to say that to help us to respond to this year's community safety update, which we brought, updated strategic assessment, which we brought back to you in the November time, as the assessments always are, will have a new section in it. This will be on cybercrime. This will be bringing together everything we currently know about cybercrime. It's based upon information and intelligence sets that we already have and are already distributed throughout that assessment, but it'll be bringing it together in a similar way to when we did the Violence Against Women and Girls strategic assessment. So again, if there's any additional information you think you have that you want to feed into that work, now is the time.
Thank you very much. Any excuse me, any comments or questions? Linda.
Yeah, I'm quite interested in, obviously, the kind of the cybercrime things and in terms of what children can access now. And certainly we had a talk at Target recently as the GP training about the harms of having phones with children and all that kind of impact. And I just wonder, how are we helping parents understand that? Because obviously in school the children get lots of lectures about what they should and shouldn't be doing, but actually it's the parents. They think they've locked down the content of those phones. They think they're safe with how they're letting their children use computers, and often the children can get around all these barriers quite easily. So is there a programme to educate the parents more about the risks?
So I think this is part of bringing that discussion here, because we need to understand what we are doing collectively through education to address this. I expect individual schools are providing information around online safety. It's a requirement of keeping children safe in education. However, as you said, to what degree people are taking that on board, and perhaps it comes back into some of the discussions we've heard here today about being able to reach into our communities and support with some of that digital divide piece. If you don't know how to lock a phone down, you're not going to be able to help your child to lock their content down. If you're not aware around the algorithms that are working very, very carefully and quietly around you, then how are you going to support your child to be aware and to manage and navigate the messaging they're receiving?
I was very interested in the part about what boys and men are accessing, and of course we've had the Online Safety Act has come in, which has made it potentially more difficult to access material. I think what worries me as a parent is that the unintended consequences of an act like that actually might drive behaviour away from more traditional areas of the internet, for example. I'm just interested in your thoughts on that, and whether the impact of that bill will be monitored as we move forward.
So obviously it's incredibly early days for that bill, and there's been a lot of thoughts and opinions on it. I think when we're talking about the content that's most concerning online, that is not being addressed by the bill currently. So yes, there might now be a requirement to show identification to access adult sites or other sites, but the some of the influencing behaviours for our young people that they're accessing readily on platforms such as Instagram, TikTok, and TikTok. That shows my age. Those are the spaces we're most worried about, because these are peers in effect connecting and influencing what appears normal. And so that's I think we don't have any regulation around that. And also I think it goes back to the conversations you were having earlier on today about that relational practice and who do you trust most. You can't legislate for everything, and what we really need are key trusted people to be able to have those healthy conversations with other people about what they're seeing and accessing, and really checking in and sounding it out, rather than waiting for something to come in a legislative way. And we see that in other areas of crime as well.
Hayden.
A couple of things, yeah. So I think on the schools bit, I think it would be mixed. It always will be, won't it? We are getting a little bit push back from schools around the number of additional burdens, let's use that language, that kind of tend to land on schools, because the wonderful opportunity of having a kind of universal service which captures 28,000 people was rather attractive for health organisations and voluntary organisations, and our head teachers do like to remind us that they are there to teach our children. So some of those kind of messages don't always kind of land brilliantly with all of our schools. However, I think Caroline's kind of call for action is really helpful, and it certainly resonates with some work we've done with some children and young people through consultation through the Children's Safeguarding Board, so the sister board to David's board, around their number one concern around safety and safeguarding is about the online space. I don't think we've kind of responded to that in the way that I think we probably need to. So I think a bit of kind of joint work between the Community Safety Partnership and the Children's Safeguarding Partnership would probably be quite a good move.
Linda.
Yeah, and I agree, it can't all just be education's responsibility, can it? And as I say, raising awareness in health, it was quite useful. What can we do with our with our contacts with people and how we can, when people are coming in, children with mental health problems and stuff, are we looking at it, tackling it, addressing it? So it is everyone's responsibility.
Thank you very much, everyone. Thanks for the reports, Caroline. It's been some good chat around there, and yeah, it's always important we remember our community safety function as the board, as we incorporate that within our functionings, and also as Caroline mentioned, the subgroup which does a lot of the heavy lifting on this and put this together. Thank you very much, Caroline. Item 7, we have relational practice updates, and we've got Rebecca joining us to do this. Over to you, Rebecca.
Thank you, Chair. My name is Rebecca Mason. I'm the Relational and Restorative Practice in Schools implementation lead here in the city. My work straddles the work of the Portsmouth Education Partnership and also the Portsmouth Safeguarding Children's Partnership. That's where I'm located. David finished his section with the comment, much of this starts with fractured relationships in childhood. If you think about the challenges you face in your settings, many of them, I would guess, start with problems in relationships. And this item today speaks to that. The relational and restorative practice work in Portsmouth started in about 2016 across the whole of the children's workforce. The work in schools gained particular traction. What's interesting is that this is not an area where schools have a statutory responsibility. And yet locally, nationally and internationally, this is an area that is gaining huge traction. As a result, Portsmouth schools, who had a huge appetite for this work, requested additional funding so that they could be supported, nudged, encouraged, trained to do this work more effectively. That post was funded by the Designated Schools Grant, and I began that role in March of 2024, so I'm about 18 months in. It built on the work that had already been done, but it gave a fresh impetus to resource schools around this work. As I said, it's a significant and growing area locally and nationally, and is a major strand of the work of the advisory board for the Restorative Justice All-Party Parliamentary Group, which I sit on as part of my role. The relational and restorative practice definition that we use in the city is an area of some contention across the country. There's no shared single definition, but the one that we're using builds on the work that began in 2016 in the city. You've got the slides in front of you for the benefit of the people who don't have them. Relational and restorative practice is an evidence-based way of being and doing that understands the quality of human experiences, individually and collectively, as directly correlating with positive experiences of making, maintaining, and mending relationships. Something that speaks to the items we've had already and items that are upcoming on your agenda. Just to be clear, this is not some kind of liberal hug-it-out approach. Rather, it recognises that punitive and retributive approaches rarely bring the hoped-for change in culture or behaviour. Instead, this approach cultivates relationships and invites those who've caused harm to be part of the solution, with a strong emphasis on responsibility and accountability, support and challenge. In schools, it provides a framework for creating and sustaining a school climate where teaching and learning can take place effectively and where students and adults can thrive as they learn from each other. Creating a relational and restorative school doesn't happen by chance. It is a deliberate act of design that flows through structure, policies, procedures, and everyday interactions. It describes a way of being, an underpinning ethos which enables us to build and maintain healthy relationships. It provides a strong framework within which we can promote a whole school ethos founded on the importance of relationships significantly, way more than a behaviour strategy. This includes a range of approaches to managing conflict and tensions in a way that repairs harm and mends relationships, if and when those relationships do break down. It is not a programme or an intervention. It is an embedded cultural mindset rather than a model. Its roots are clearly in restorative justice as a way of repairing harm, but relational and restorative practice has a much bolder ambition of proactively developing the sense of community and seeking to increase the social capital between and across the school and from there to the wider community, something our world really needs right now. Our local vision is for all Portsmouth schools and colleges to have support to ensure pupils and staff experience the lifelong benefits of relational and restorative practice in and beyond their education. The infographic on your next slide summarises the offer that there is to schools and supports the complex web of relationships that we have in the city and those relationships between the City Council and the multi-academy trusts. The benefits, what's going to be the return on this investment from the designated schools grant? So what you'll see there is what we are expecting to see. So it's still early days, but we are expecting to see and are beginning to see an increase in inclusion, increase in connection and support, an increased climate for learning, increased conflict resolution in schools, increased staff and student well-being, increased academic engagement, increased attendance, and a reduction in negative behaviour and exclusions. That's the picture that's emerging across the country, and that's the picture that's emerging for us locally, although it's too soon to speak very concretely to the evaluation piece. I'll say a bit more about that in a moment. So why this emphasis on relationships? Just a word about that. I think it's really important. Many of you will be familiar with the Harvard Adult Development Study, the largest study in adult development in the world. It's run over many decades and many, many thousands of people. It is the gold standard of understanding the predictors of people's life chances. And what that study has found, and there's a brilliant TED Talk if you don't want to read the book, but there's a brilliant TED Talk entitled A Good Life by the current Chief Exec of the Harvard Adult Development Study, Rob Waldinger. And what they found is that close relationships more than money or fame are what keep people happy through their lives. Those ties protect people from life's discontents, help to delay mental and physical decline, and are better predictors of long and happy lives, more than social class, IQ, or even your genetics. The evidence is as compelling as the evidence about the impact of smoking. So this emphasis on relationships is not a marginal aspect of our work. It is the work. It is the foundation on which everything else that we do is built. Because without these relationships, very simply, as that research identifies, our lives are sicker and sadder and shorter. There's a scale and pace to the field of developments in this country. There's work coming out of many of the big universities and some of the smaller universities, work being done locally here, Portsmouth, Chichester, as well as Cambridge and Bristol. Many of you will have seen a year ago the Surgeon General in the States circulated a very important document, talked about one of the best predictors of outcomes in education was the level to which people felt like they belonged. One of the things that we are hoping and expecting in the curriculum and assessment review that is due for publication this autumn is that there is going to be a pivot in our education culture towards the importance of belonging as the foundation for children's lives and educational outcomes. The next slide speaks to really just the task and the focus of the work that I'm doing with schools. And then the following slide, just a little bit about the offer to schools. What I said earlier is that this isn't a programme, it's about some principles. And to that end, we are able, because of the size of the city, the 28,000 children in schools, the 61 schools, we are able to have a bespoke offer to schools, which speaks to the needs that they have. I'm not precious about my way in with schools. I don't mind what the route in is. That's fine with me. Increasingly, there are new head teachers who are coming here because they understand this is the Portsmouth way. So if that's the way in, then grand. Sometimes it's about the personality of the person who's leading that school. Sometimes it's schools that are taking a pedagogical pivot because they've seen the benefits of this kind of way of working. And also we know that there are schools in our city where there are real problems, and there are other schools who are coming, I wouldn't say kicking and screaming, but are needing some persuasion. So I don't mind what the way in is. I'm happy to go anywhere that people will have me. And to give you a little bit of the data, so 84% of our schools have had some engagement with this work. More than 49% now of schools have had bespoke inset content. The thing that I think we are probably most proud of is that this is a culture and ethos piece. Head teachers' times, as you well know, is incredibly precious. This work is not a statutory requirement, and yet we have delivered and are delivering a head teachers programme which requires head teachers to attend for a day every half term for 18 months. So it's a massive commitment on the part of head teachers. We've got 3 cohorts running, and we have 67% of the head teachers in the city on that programme. One of the schools in that programme has seen a 50% reduction in exclusions. The other emerging data around that for the schools engaged with this work is hugely encouraging. One of the special schools that we have in engaging with this work saw a 60% reduction in their behavioural incidents in the school. So they had 760 September to December 2023-24. And when they did this piece of work, including their whole staff, the reduction was down to 260 in the same period a year later. Trafalgar School have really led the way for much of this in the city and supported other schools too. And they've been doing some interesting research around all sorts of things. One of the areas is the difference between intrinsic and extrinsic motivation. It's very easy to, with correction, get behavioural compliance. Whereas with connection, what we actually get is character for life. It's a different approach. The educational psychologists from, the trainee educational psychologists from Southampton have done some really interesting work, which they're about to publish, looking at the experience of children in our schools and what do they say about schools that are purporting to be relational and restorative. There's ongoing work to evaluate my role, the leader's work, and all the other strands and aspects of this in schools. We are encouraged by what we're seeing already over this summer. The schools that are really embedded into this pathway and this way of being have attributed some of their encouraging GCSE results to their relational and restorative approaches. If you're interested in any further evidence, please do have a look. I've given you a whole host of things there, and I'm very happy to be contacted for further conversation or questions or evidence. I want to just finish with a quick story from Gregory Boyle, who has written a brilliant book recently called Cherished Belonging. Gregory Boyle founded the most effective gang disruption and rehabilitation initiative in the world. It's based in LA, and it came out of what they called the Decade of Death that ended in 1992, where they were seeing more than 1,000 gang-related deaths a year. And that work has been transformational. We've got some of those projects. It's called the Homeboy Industries in the UK now as well. One of the things that he talks about is he says that many of the people who've come through their work and through their initiative have been homeless at times in their lives. And what he says is that those are not people who ran out of money. They're people who ran out of relationships. And so the thing that really underpins everything that we're doing is this idea that no Portsmouth child will run out of relationships. Thank you.
Thanks very much. Any comments? I can see Hayden itching coming in there. So over to you, Hayden.
I just want to commend Beck on all her work over the last year and a half. It does build on the foundations that we kind of built in 2016. I just think it's a really interesting example. I spent quite a lot of time talking about SEND specifically with the DFE because we're one of the kind of pilot areas in lieu of the white paper coming up. We've got a visit from the DFE coming up, and one of my constant refrains of the DFE is this inclusion is about relationships, it's about culture, it's about leadership. This is one of those kind of rare areas where focusing to address issues in the city rather than just spending money and setting up more services and talking about integration, as important as all of that stuff is, actually what we're talking about is culture, leadership, values and behaviours. And we're seeing measurable impact now in terms of the inclusivity of some of our schools. We've got secondary schools with 300 times the suspensions of other secondary schools a mile down the road. That is not about the children, that is about culture, leadership, behaviours and values. So really kind of pushing on that agenda in a very short period of time. We've seen some really, really amazing impacts. I think we're beginning to see some impacts on educational outcomes as well, not just attendance, not just exclusions and suspensions. So again, it's all about leadership and culture, and Beck's done an amazing job of kind of leading that programme and really using the evidence base to impact on our children in the city.
Thank you. Andy.
I think this also talks to an earlier point really when we were talking about prevention, and we were talking about that from the perspective of people that self-neglect or might be dislocated from their communities or their relationships in the city. And I guess this talks into something where you chuck stuff down the road because you know it's going to work and you know it's going to have an impact. You can see the impact that you've outlined for us here today. But if we talk about prevention, if we think about prevention in very broad terms, if we think about health and wellbeing over a life course for our residents, then it starts with this kind of work: healthier relationships, better connections, people that learn to care about each other and learn what unites them rather than divides them. I mean, we could always be able to teach the world to sing, but there's something here that talks to those foundations of healthy communities. I think very broadly healthy communities, and I think it's work to be commended. Thank you.
Thank you. I thought this was a really interesting report and really fantastic work. I just wanted to make an observation. I think within the city we have a really great community growing around this, so this is beginning to sort of really escalate quite rapidly, so I think it's brilliant. And just for information really, the university's policies are all being looked at the moment to try and move them away from that punitive approach to difficulties to being much more restorative in the first instance. And I think there's a real willingness amongst that. But just to come back to the culture piece, of course, it's getting people to change their mindset that the only way to deal with an issue is through a adversarial approach. And that will take time to address, but I think we're seeing real progress in that.
I love the comment from Gregory Boyle where he says, if you have a behaviour problem, pay attention to your belonging culture.
Helen.
Great presentation, really good. It felt like a really real story for Portsmouth, and I think there's a lot to be said for building on this in other areas, and I know we are starting to think like that, but it just reminds me, and Helen's going to be presenting on the ICP Integrated Care Partnership priorities later, but we've got one of those priorities is social connectedness, and it strikes me that at a stage, and we've kind of covered quite a lot today, particularly around connectivity. We've got AI, we've got a huge amount of opportunity to connect with people, yet seem to have less positive relationships, more loneliness. And it felt that there's a lot to be learned from this work in all of our public sector services.
Thank you. And Hayden, I just want to pick up on that stat you just gave us. That's quite terrifying. The suspensions and exclusions at some schools are 300% of the others. And that's nothing new, is it? I mean, I remember when I was at school outside the city, I'll make that point. My school was the school the expelled children went to, before they went to the exclusion unit, because they got expelled from our school as well. But that was the last thing. But the other schools, effectively, other schools in the town where I grew up were excluded and dumped on our school. Obviously, we were the all boys school, whatever, and it's there's nothing new in that, but it's something that I think schools that effectively, I think this report is amazing, and thank you for all the work you do. But I do find it astounding that some schools don't want to be part of this still, and I think that I think the empowering and speaking about this and really promoting this as being effectively, this is what you should be doing. In a restorative way, of course, not a punitive way, not telling them they should want to do it. But I mean, this is the point. So, and I think we've heard all the reports we've heard so far today, apart from maybe the pharmaceutical needs assessment. But they all, I think, all of them would be more positive if this was permeating through everything we do in our community. So, Linda.
Yeah, and I think it's a great piece of work. I suppose, but just moving towards more digital access for everything, I would be sad that we might develop some really resilient children that have great relationships, and then we give them faceless organisations where they just relate by accessing with digital. So we just have to be really mindful when we're moving that way that we don't undo the relationship building that goes with a traditional face-to-face or a telephone call.
Hayden.
Sorry, I couldn't agree more. And again, a very live debate around neurodiversity in children, because there are organisations developing AI tools to understand neurodiversity, and that really frightens me, because actually the kind of our expertise and experience in Portsmouth has been it's through relationships and conversations that we understand how children function in different environments. No computer is going to tell you whether you're autistic or not.
Yes.
Thank you, Chair, and just want to echo everything that everyone said about that. I think there's something about the way that we try and work as a health and wellbeing board in Portsmouth, which isn't about talking about individual initiatives. It is about thinking about the way we're working together as a board, and coming back to that sort of underpinning of the strategy, the creating the conditions in which people can thrive and that services can succeed. And I think this is hugely important around that. I think, Hayden, we spoke about potentially bringing this into more detail into a development session for the board in future, and also building on some of the work around trauma-informed practices as well. So if the board's in agreement, that's something we can look to put in before the next session.
Yeah, that sounds really good. Happy for us to. Everyone happy with going forward with that? Yeah. Steve.
Thanks, Matt. Soapbox moment for me. Colleagues who know me well will not be remotely surprised about what I'm about to say, but in response to Linda's point, it's a really important one. And from a cultural and creative industries perspective, all the more important that the A is in STEM and we are talking about STEAM, because if young people do not understand how to engage creatively at a younger age, that's going to become increasingly a problem as we move over towards digital functional operation of society rather than the human interaction within it. And all the evidence points to the fact that if young people at an early age do get regular and meaningful engagement with culture and creativity, both in the classroom setting and beyond, then their STEM results improve anyway. It's a big tick for the teachers, something that unfortunately there are still far too many that do not understand it, and I confront people every day about this issue because it really does matter. And I get the pressures around exam results, etc. That's there, but the evidence says they will be better if you invest in this. But it is important because those joint cultural creative experiences are where human relationships are most easily formed, because people will be more open when they are engaged in creative practice than they will be in almost every other setting. So it's absolutely crucial as we move forward that we don't allow digital technology to replace human creativity, because human creativity is the core of human relationships.
Thanks, and I'll just conclude it. I think bring on Linda's point. There is we get lots of messages, and I'm not making this past political. I'm making a point here. from central government, because they do. It doesn't matter who's in power. Central government loves about we're going to shift to digital, and it doesn't matter. When I was a civil servant, go back. I started over 20 years ago, left over 10 years ago now. I worked for the Department of Work and Pensions, and they would move into saying, "Oh, we have to move people away from actually coming into physical offices and things like that." And so this has been going on a long time, and we hear this from the NHS with their 10-year plan, and we hear it from other aspects of the community about, oh, you should be turning towards more digital, and then it forgets about the fact that for a lot of people, either it doesn't work or it's not the best way to interact. And so it's a case of, for us across all of our organisations, is even if we're getting directives or being strongly encouraged to do things in one way, that we have to be that relationally that often doesn't work, and that you start to exclude people, and then they can just become a bit of a thing. So I think that's it's a really important point, and I was going to bring you back in anyway, Rebecca. So to sum up,
I just wanted to speak to that by way of conclusion, I guess, which is that the building block for much of this in many school communities, not all school communities, but in many school communities, is community circles, be that staff circles or student circles. So many schools will tell you about how on a Monday morning, every member of staff is in a small community circle. All the students on a Monday are in a small community circle. Check in on a Monday, check up on a Wednesday, check out on a Friday. And what they're seeing is children and adults' experiences of school transformed because they are sitting down and talking to each other, understanding each other. It speaks to all manner of other things to do with the issues we have in the city around oracy, children who previously, you're not going to be able to write something if you can't speak it. And children who are sitting in circles together, who are having conversations, well facilitated either by older peers or member of staff, where it's ironing out some of the issues with, say, transition through the different stages of school life. And this, it's alive and well in our city, people sitting down, face-to-face, having in-person connections that are building relationships and being transformational.
Thank you very much, Rebecca, and thanks so much for the reports. And it's, well, got the juices flowing, didn't it? Okay, so next we got the Tackling Poverty update. We've got Katie coming to present to us on that.
Good morning, thank you, Chair. I'm Katie Ricks, I'm the Tackling Poverty Strategic Coordinator for Portsmouth City Council, and I'm presenting the report today, which gives an update on the Tackling Poverty Action Plan, which has been taken forward by partners across the city, and obviously overseen by the Tackling Poverty Partnership Group. So I'm just going to give a quick summary. So the current picture of poverty in Portsmouth, we know that those children in relative poverty account for about a quarter in Portsmouth. In respect to fuel poverty, that's affecting 13.2% of households. Income and employment, average earnings are below the national average in the city, and we have over 29,000 residents claiming universal credit. We also know that there's a growing number of households who are in work who are living in poverty. Health inequalities persist, so we know that life expectancy is 8.5 years lower for men and 6 years lower for women in the most deprived areas of the city. And educational attainment, pupils eligible for free school meals score lower than their peers. There's a 14.4 point attainment gap. So the cost of living pressures are persisting within the city, as we're all acutely aware of. Food prices continue to rise significantly, and they've actually risen by 37.7% since 2021. Rent and housing costs continue to outpace housing benefit allowances, leaving lots of families with a significant shortfall in terms of their finances. Energy bills are continuing to rise, and water bills have increased significantly this year also. And that's all contribution to high levels of debt across many households, and those households are then having to cut back on essential items and a greater reliance on things like our food banks within the city. So local welfare supports still, primarily this is funded locally through the Household Support Fund. So we're delivering our support within the city, which is £3.3 million. That has been a reduction from previous years, and we're using that to provide both crisis support in the city and also preventative support. So we're looking at our money advice offer, increasing benefit uptake, supporting households in terms of energy efficiency, food support I've spoken about, and lots of application-based support to help those who are in crisis. Moving forwards, we know the Household Support Fund from April next year is going to transition into the new Crisis and Resilience Fund. We're still waiting for further guidance around that. The DWP at the moment are co-designing how that funding is going to look, working closely with local authorities and other interested stakeholders. We know that the amount coming into the city should remain the same. They've committed to 842 million, which is the same amount from Household Support Fund and also discretionary housing payments, which is also going to be included within the new funding. At this point, we know that there's going to be continued emphasis on preventative supports, which we've seen in Household Support Fund this year, and looking at community level support as well and how we utilise our community partners in terms of supporting those most vulnerable within the city. So the council's and partners' strategic response to poverty within the city is set out within the Tackling Poverty Action Plan. We've got 5 areas within that, and we've been making some excellent progress against lots of those. For example, around data sharing, we've been successfully piloted free school meals auto-enrolment with Year R this year, which has seen a £225,000 increase for the pupil premium that schools receive. We've also been sharing data with Southern Water and moving eligible households across onto their social tariff, and that so far is accounting for £993,000 reduction in terms of household bills. In terms of making information accessible to our residents, the Cost of Living Hub and Helpline continues to support thousands of residents every year, and a great source of support in terms of information around what help there is available. Community engagement, there's been a number of research projects that we have then been able to learn more about households and things like how poverty is affecting their emotional and mental health and impacting on children within households as well. In respect to employment access, programmes like Multiply and Connect to Work have delivered skills development and employment pathways within the city, and our food security network through our banks, pantries, larders, community meals continues to grow and continues to see demand increase across those. We've also been looking at affordable cooking, again, preventative measures, working with communities to teach households skills in terms to be able to cook more affordably and having to rely on more expensive forms of feeding themselves. So the next steps is there's an opportunity, I feel, at the moment to look at revising and updating the action plan. We know that this autumn there's going to be the Child Poverty Strategy published by government, and we're also, as I say, waiting for further guidance around the new Crisis and Resilience Fund, which will certainly feed into the new plan moving forwards. Been working with members within the Tackling Poverty Partnership Group, and they've already identified some themes that they would like to focus on, but again want to engage with stakeholders across the city to really inform that collective partnership response. So at the moment, some of the key themes are around increasing benefit uptake. There was a report this month by Policy and Practice which highlights that there's £24 billion worth of support being unclaimed nationally. So we want to use some of that intelligence in terms of unclaimed benefits to really increase uptake. And we already know that through work we undertook within the last year around pension credit, we were able to make a real difference there to pensioner households. We also want to look at how we can maximise household income through money guidance and supporting frontline workers to have more effective conversations with those that are supporting around household finances. Want to work with our communities and our community providers to enable them to deliver wraparound support. So this is lots of stuff that we already see happening in some of our food banks, where they bring in advice services, Switched On Portsmouth, other support services within those settings, because they have established relationships within those who are accessing their service, and then can more effectively engage and signpost into wider support. Want to take forward the report from UK Harvest that's being written at the moment around food support and how we can create our food support network to be more resilient in the city. Again, looking at collaborative purchasing and how we can, yes, be able to sustain that, because at the moment they do receive a fair amount of funding to deliver their support through the Household Support Fund. We also want to look at gambling-related harms within the city as well, and we've already engaged a lot with public health around taking this forward and putting a working group together. You know, I hear a lot through our partners who I engage with, but also through our Household Support Fund application-based schemes, how gambling is a real issue for a lot of households within the city. So the plan is to then develop the plan, as I say, with key stakeholders over the next few months, and would like to then come back to board early spring to obviously present that revised and updated plan to then take forwards.
Thank you very much, Katie. Graham.
No, I was the first one. I want to ask two questions, really. One was, the council did some work recently to help increase the take-up of pension credit. How successful was that?
Yeah, we had an increase from August 2024 to April 2025 of 119 households, which doesn't sound like a lot, but on the basis that the average financial benefit is £3,900 per household, that's actually £464,000 increase within the city for those 119. So yeah, it's, you know, things like that can have a really, really big impact, and we want to do more of that. Looking at pension credits, things like attendance allowance, healthy start. So.
Well, that sort of moves on to my second question, because you talked about having to revise the strategy, and one of the things is about increasing eligible benefit uptake. Going back a long time, when I was previously on the council, I was chair of housing in the 1990s, early 2000s. One of the things we did was the area housing offices worked very closely with what was it's DWP, but it wasn't called that then, but benefit offices involving benefit and employment, and went into those offices and actually were contacting and working with people who were council tenants in particular, to ensure that they were getting all they were entitled to. It was very much a sort of go in and do something in those areas where we had, you know, higher levels of poverty. I don't know if that work has sort of stopped and started or not, but is that something that will be done, or are there other ideas about how we can improve benefit take-up for those who are entitled?
Yeah, that work is still going ahead, and we have our money advisors within our Port City Council, obviously housing properties, and again, you know, there's a lot of organisations that are able to use benefit calculators and things like that to try and support and identify those benefits that are those claimants might be, well, those households would be eligible for but are not being claimed. But the other thing is there's also data and data analytics tools. So one thing I'm hoping to do is, again, policy and practice, they have a low-income family tracker tool, which takes DWP data and takes data that we hold as well in terms of housing arrears, and we'll be able to create a picture of households, low-income households within the city, and then we'll be able to use that data to be able to target our campaigns. So we should be able to identify those who actually are likely to be eligible for things like pension credit, directly send them out letters, encouraging them to obviously, and give them information about how to apply. So, and that's been successfully done in a lot of councils across the country as well. There's been some really good practice around that, so that's something I'm hoping to replicate here in Portsmouth.
Steve, then Linda.
Thanks, Matt. Just a couple of things, because obviously I work directly on the tackling poverty stuff with Katie. One, thank you, because you've replaced the work that Mark was doing and stepped into those shoes, and I think you've filled that role brilliantly, and things are moving forward at pace. There is a bit of a risk to identify around the new combined fund that the government's bringing forward, only in as much as we fear over prescription. So we need to know that we're going to have the flexibility to continue to target the resource where we know locally it will make the most impact. So it doesn't matter what colour a government is, all governments like to be in control of the outcome so they can measure everything. Drives me completely mad. But in this instance, they've got to allow us that flexibility to be able to target this properly locally. So with just a watching brief on that, we'll see what information comes out. Couldn't agree more or support more the advocacy around getting support and advice services when into our pantries and our food network at a point where the client is ready to receive it. It doesn't work if we just on day one have a line of people there to help. That doesn't work. You have to get the client to, and this is why pantries are so successful, is you get the client comfortable with the pantry, they get to know the volunteer team that run them, operate the pantry, they start to share with that team, and then the team, having built that relationship, feel confident that they can identify the right point in time to make that referral, and then there is so much better outcome from that engagement because there's a trusted relationship there. So it isn't about shoving people out into communities to do that work. It is about having them there ready at the point that the client is ready to receive that help. And I've seen firsthand that happen in a live setting environment, and the speed at which that relationship with the advisor then developed, and therefore the problems getting solved. And the third piece of work around UK Harvest, it's a really important piece of work because the demand is going up on the food network, and we know that we're not getting increased money. You know, we're going to still get what we get, but it was a drop this year and it will be standstill going forward. So we need to make the money work more efficiently. For people who don't know, some of the, I'm not going to name names, but some of the providers to the network currently give you what they've got, not what you need. So one particular pantry that I was at one day had just had a pallet of Diet Coke delivered. And that had fulfilled their quota that they were entitled to for that week, which, you know, lovely. There's lots of Diet Coke here, but there's no tins of beans, there's no tomatoes, there's no, you know, all the stuff they actually need to give out. So what we're trying to create with this, what the partners are trying to create with this, is a better system that enables that if that pallet of Diet Coke did arrive, there's a central repository to then split that across so everybody's got a bit of something, similar with beans, tomatoes, pasta, rice, everything. So it's about creating a more rational network and not having some people with pallets of Diet Coke or other people with 3 million tins of beans and other people with none. So the partners have been responding really well and working together and coming together to try and make that work. It's something we've needed to do for a while, and UK Harvest have added quite a lot of value into that because they understand the system really well. Linda.
Yeah, thank you for the report. It's really informative. I think the thing that struck me was about the rent and the fact that actually that housing allowance doesn't cover even the basic cost of rent, which I naively assumed it would, and I think that's quite shocking. I assume that's private landlords, is it? Or I assume council housing would match, would it, in terms of rent payments? Or?
Testing me now. Is it mainly privates? Yeah.
And what are we doing to work with the landlords to make sure we try and keep the rent? We can't.
Yeah.
Oh, okay. Yeah. So I think that's just shocking, isn't it? Because we talked to them in this meeting, we've talked about homelessness, the risks of homelessness, and actually, you know, just to keep your roof over your head, you haven't got enough money.
Yeah.
So, yeah.
Yeah, and it leaves so
striking.
many households with already at a deficit.
Yes.
You know, because of those housing costs. So.
And some of the other initiatives are fantastic, but if you can't even pay for the roof over your head, I don't know how you do the rest.
Yeah, and there's a whole thing there, you know, in terms of, I know Joseph Rowntree Foundation have been looking at the essentials guarantee as well, and how, you know, if you look at universal credits, for many households that's not enough to cover the essentials.
Steve.
Just quickly thought, how can I say this in a way that I can't be accused of reading? So I think I can, because I think there's more than enough information out in the public domain to sustain this, and there have been local examples, including from local councillors, where, just to give you an example, Linda, a rent went from £850 a month to £1,400 a month in one hit. And it is that the speed at which that's happening. There's also been lots of reports already taken by the council to show that we have a housing crisis in the city and that there's been a massive spike in TA demand. That's why. Because people can no longer sustain private tenancies, so they're arriving at the front door of the council having become homeless, Section 21 notices, all that stuff's been in the press, and the council doesn't have the council housing to bring them into. So that is what is causing the housing crisis. There are other reasons, but if I had to pick one factor, it's the speed at which rents in the private sector have risen, far outpacing the amount of support available in terms of benefit to be able to sustain that rent, so tenancies failing all over the place. That's what's creating all the demand at the front door and all the other problems that go with it and everything that Katie does every day and BCSE across the city.
Thanks, Steve. And thanks, Katie, for your report, and looking forward to the revised action plan coming next year. But really encouraging work, and as Steve said, thanks so much for all the work you've done since you've come in. This is a really key area, and this is going back to my so the interesting thing about local housing allowance, here we go, I'm going to do my DWP bit here, is that of course it's so that and housing benefit are actually national benefits that are, and even local housing allowance do we even administer it anymore anyway, but it was a national benefit is administered locally, even housing benefit, and it's always been about calculated. There's always been a calculation that's set from the centre, and it's not something we have any control over whatsoever. So, and it's not dependent on your rent. It's just traditionally the rent had been low enough that it'd be captured within the amount that's available for local housing allowance or housing benefit. But these days, especially with local housing allowance, because that is for private, that is for people renting privately, that it doesn't. It generally doesn't now, and it's just the case that the gap's gone, so people now notice it, whereas before they didn't. So that's one of the real problems that you've got, whereby rents and housing costs are just rising up to a point whereby what's been in place forever is not actually, or for a long time, is not actually covering those costs anymore. And so this is just, it's everything's on a lag, and it's just, but it's part of really, I suppose, and I'm sure Katie would agree, it's just cost of living stuff is going up and up and up and up. It's just one of the symptoms of it, whereas his incomes and what's available just isn't keeping up with it. And that's why we're in the situation we are. And that's for all kinds of reasons, you know, both policy that government has pursued over, 20 odd years, or whether it's things we have no control over, like financial crises, COVID, Donald Trump and his tariffs and things, who knows what else. So it's just the things we can't control, but it's that gap between what's available and the cost, which is why the work that the partnership on tackling poverty in this city is so important, and is doing a brilliant job, but also recognising that they, again, work's been done, there's more work to be done, and there's things that should change about the action plan, because things are changing all the time, including things like this that we have to do. So thanks so much for your reports, really appreciate that. To item number 9, so we've got Chris and Jane coming to bring us the suicide action plan for Portsmouth.
Thank you very much, Chair. I'm Chris Johns, Consultant in Public Health for Portsmouth City Council.
I'm Jane Leach, Development Worker at Portsmouth City Council Public Health.
I'm just going to take you through some of the highlighted parts of the report that you'll have all have received. First of all, I just want to commend the work of both Jane in the Public Health team and also Kerry Pearson in Adult Social Care for their work both on the action plan but also the suicide prevention partnership. The background to this plan is that in 2013 the UK government encouraged all local areas to develop and implement multi-agency suicide prevention plans. And the plan that is presented today aligns with national guidance and also built in local intelligence, for example, from the public health-led audit of coroner's records of suicides. The action plan itself is overseen by the Portsmouth Suicide Prevention Partnership, and this reflects the call for coordinated cross-sector action. Since 2016, death by suicide in Portsmouth has decreased from significantly worse than the national average to roughly similar to the national average, currently at 10.7 deaths per 100,000. In Portsmouth, our analysis has helped us to identify key local risk factors, and these are included in both the report that you have in the pack and the attached plan. And understanding these factors helps inform the prevention and engagement with support services. And we also seek to understand those groups who may be at higher risk of suicidal thoughts, behaviours, or death due to specific vulnerabilities or life circumstances. And combining that national and local intelligence really allows us to do that. And again, those priority groups are listed within the report. So the action plan for 2025 to 2030 sets out that strategic and evidence-informed approach to reducing suicide across the city. And the action plan, I think one of the real benefits of this plan is the collaboration with statutory and voluntary sector partners. And I'd also like to thank all of those partners for their commitment to this vital work across the city. The Portsmouth Suicide Prevention Partnership meets quarterly and will be monitoring and evaluating this plan to ensure the progress and also to respond to any emerging needs throughout that period. The actions themselves within the plan that are held by those organisations are structured around 7 strategic objectives. The first, to provide and promote targeted support to priority groups, including those at high risk. Secondly, to address common risk factors linked to suicide. Also, to promote online safety and responsible media content. To reduce harms, improve support and signposting, providing helpful messages about suicide and self-harm. Fourth is to promote effective crisis support across sectors for those who reach crisis points, and also to reduce the access to means and methods of suicide where this is appropriate and as an intervention. Provide effective bereavement support to those affected by suicide, and this service is commissioned by Portsmouth City Council across the Hampshire and Isle of Wight patch, and also to use data and evidence to continually inform what we do. So the plan itself is detailed, recognises how essential it is that we maintain and build on local partnerships to better understand those most in need. And I'll stop there for any questions.
Thanks, Chris. Any comments or questions? Steve.
Not specifically about the content, but just to give a shout out to the fact that the Baton of Hope's coming to the city later this week, on Friday, I think, and raising awareness around this particular subject in a very important way. And having met some of the team delivering that, it's in itself providing a support network for people who have experienced this sort of trauma in their family, but also to the work of organisations such as the Parenting Network, and to the work that Sarah Mitas and the team from MAKE have been doing with their Let's Talk About Suicide event that they hold, normalising the conversation around the issue, because that is part of the problem in itself, making sure that people feel enabled and empowered in this space. So I think it's important that we recognise the work that the VCSE has been doing.
Thanks, Steve. Oh, hey.
The bit of the report that kind of jumped out most is the high proportion of women compared to national in the last sort of 10 years or so. Do we have any understanding? I know it's small numbers and I get the fluctuations, but actually it's not even fluctuating, it's kind of consistently above national for a decade. Do we have any local intelligence as to why that might be?
No, we don't have local intelligence. We can't pick out, the age groups fluctuate. What we do is we take a life course approach to it, so to try and understand what kind of societal and emotional pressures different age ranges might be experiencing. There's very little, well, there's a little bit of research about younger women, so we have put out campaigns around encouraging younger women, addressing their specific distress signals like young adulthood, moving into young adulthood, being a young parent, potential past sexual abuse, issues like that, where the profile for nationally for women who take their own lives, so there are other ones, but locally we don't have that level of sort of intelligence or data. So what we do is we piggyback on our understanding of the profile of distress for women across their life. Yeah, across their life. Yeah. So no is the short answer to that, but we do have plenty of intelligence that we do also use to inform, raise awareness, and where we can include resource to address that.
Thank you, Jane. Thanks for the report. I think we were talking earlier, weren't we, about safeguarding everyone's business, and I just draw everyone's attention to 3.5, where the strategic vision for the suicide action plan is making suicide everyone's business. And I think those kind of things are, and again, I think lots of our reports are linking into that, aren't they? So it's really a case of being aware. And I remember actually Jane working a previous job, but I did a course with Jane about suicides many years ago, and it included people on that course from which was about mental health, but we did obviously a bit on suicide, and we had people from the Drift Bar down in Southsea, and that was so that really does show, because that's the kind of thing to not just get our organisations here and there, but it's like about businesses and people in all walks of life being confident about speaking to people about suicide and obviously trying to prevent suicide as much as possible. So really important thing, and thank you so much for bringing it today. So we move on to item 10. I think Amanda is sitting for Gareth, who's going to tell us about the Portsmouth Smoke-Free Alliance.
Thank you, Chair. Yes, Gareth's been great at putting this paper together. He's on paternity. He had a lovely baby girl.
Congratulations, Gareth.
Thank you. Yes, so the Portsmouth Smoke-Free Alliance update. So just a bit of an update how it came to be and the progress that we've made so far with it. So just not that I need to explain it, but I do want to highlight still the largest preventable cause of illness and death is smoking. We have done really well as a city. We've reduced our adult prevalence down to 10.1% recently, which is really great. It's in the right direction. However, when we look at our other groups, so we've got mental health conditions, the prevalence is 22%. People in routine and manual work, the prevalence is 17%. So we have some inequalities that we still need to address as a city. In 2019, the government announced the ambition to have a smoke-free England, which means the reduction of smoking by less than 5%. And actually, along with that came additional funding and additional targets around our escalated quits for smoking within the city. The one thing that I'm hearing through this morning is that level of collaboration with organisations. So this isn't something that public health can do by themselves. We needed to regroup our collaborations and to support our smoke-free action plan for Portsmouth. So therefore, we set about reconvening our Smoke-Free Alliance based on our tobacco action plan, around the priorities, to invite those partnerships and those organisations to come along and to then get a commitment and a shared understanding of where we were and where we needed to go. and we started that process about this time last year. We had our initial meeting online in September, and we had our launch in October. So the Alliance is nearly 1 year old. In that time, under the headings, and the Tobacco Action Plan is on the JSNA if you're interested to have a look, but we've got the 4 main areas of work, which is stopping the start, supporting people to quit, effective enforcement, which covers our trading standards work, or the partnership work that we're doing with trading standards, and then collaboration, which is a golden thread that runs through the entirety of the plan, but also the Alliance. So just some of the highlights of some of the pieces of work that have come out of the Alliance, the partnership work, and it is by no means public health leading on this. This is absolutely a collaborative approach with all the partners around the table. So working with trading standards around the effective enforcement, we've been making sure that everybody's aware of trading standards roles around that and understanding the struggles that there are that trading standards have to face around illicit tobacco and also illicit vapes as well. And how they would deal with that. And actually, how can we, because there's 2 sides to this. There's the enforcement side around tackling the supply, but actually our role as public health is to tackle the demand for those products with our stop smoking services and support for schools in education. So the work that they've been doing has been fantastic, and we've been making sure that we've been feeding intelligence into them and supporting where their progress with that. That links into some of the other work that we've been doing within the Alliance around youth smoking and vaping. 2 very clear messages around vaping, just to put it there to make sure that it's out there. If you don't smoke, then don't vape. If you smoke, then vaping is an effective tool to help you quit smoking. It's not swapping one for another, it's about harm reduction, and that's a very clear message. Unfortunately, that message is being skewed within our communities because we're advertising vaping, the colours, the flavours are quite appealing to young people. So what we've been trying to do is to work with engaging young people and young community groups to find out actually their thoughts, their feelings, what do we need to do to support them and to get that education out there. And there's been a really great piece of work where young people have actually helped co-design where we will be going with this, and they've come up with the priorities that the Alliance will take responsibility for moving forward. And those priorities is around strengthening our intelligence and research around the prevalence of young people vaping and smoking, but also equip professionals and services to address smoking and vaping concerns, deliver targeted campaign and messages to challenge the myths and to get that message correct within our communities, create supportive environments and enforce regulations to reduce the availability and the visibility of vapes to under 18s, and continue that leadership and action on youth smoking and vaping. And in the wider scope of this is what we're doing in Portsmouth, this is what others are doing in their local areas, but also we have the Tobacco and Vapes Bill, which is currently still going through the House of Commons. We haven't had an update on that recently, but hopefully that will start to gather momentum again soon. So I think that's pretty much the update. Happy to take any questions, but the next Alliance will be in October, and we'll have an update on where we are with that and the progress that we've made in the last 12 months.
Thanks very much, Amanda. Any comments or questions? Graham?
Yeah, thank you for that. I was interested in the priorities about strengthening data, and I suppose what I was interested in is what do we actually know now? Is smoking, traditional cigarette smoking among young people declining and vaping increasing? What do we know now is, I suppose, what I'm trying to get to, and what do we need to know more about?
Yeah, so it's a good question, yeah. So we gather data on adult prevalence of smoking, and we can then break that down into whether they're routine menu workers, mental, etc. We don't gather that data as well for young people and vaping, and the trends around that is changing so quickly that even if we did get that data, it would be out of date within weeks, months, etc. So it's a difficult area. What we do know, yes, smoking is on the decline, youth vaping is on the rise, and that's why we're trying to react to that. I don't think we're in a situation where vaping is the new smoking. It hasn't replaced it, and I think the messages are quite clear that it is meant to be a stop smoking support moving forward, and that is definitely underpinning in our Swap to Stop campaigns. It's not about replacing one bad habit for another, it's about that evolution of harm reduction.
So my second question was about where young people acquire vaping when they're not supposed to. Is it generally through physical shops, people visit, or is it online? And how can we be more effective at combating that?
All of the above, all of the above. And also what we're finding out through the engagement that we're doing with young people is it might be younger people who are accessing them for younger people. Some younger people in schools have made a bit of a business and an enterprise out of accessing vapes and providing them to their friends. They can order online. There is loopholes. Government are very aware of that. We're aware of that. It all links in with some of the safeguarding and the online work that we're hearing. So there is mechanisms that we're trying to stop. The Tobacco and Vapes Bill will be a real big driver in that, and that will actually help untie our hands where there is that. But the culture and the prevalence of this is moving so fast, the technology is moving so fast that we're trying not to be behind the curve, but that's where we are, and it's difficult to keep up with it.
I mean, just to comment, I think I've seen a couple of reports where young people have been invited to bring what they have acquired as vape material in, and then they've analysed it to see what's in it. And there's all sorts of stuff which is just like, they just don't know what they're buying, basically, and that's horrendous, really. And obviously the young people who have had that have been quite shocked at what they've found. There have been a couple of news reports, I think. But, they are putting themselves at real risk, and they are being exploited, for commercial gain, and it's a real tragedy.
I think you've probably said it, but just to add to what Amanda said, I think it's really difficult because there are it must feel out in I suppose for residents, whether you're a child, young person or an adult, that we're giving slightly mixed messages. And I think it's important to actually be clear, and it is a difficult one, and we are getting a lot of feedback because what we are saying is it's okay for adults to vape in the context of trying to quit smoking. It's not that you're going to vape forever.
Exactly.
And I think, and the other thing is to say is that we obviously give out, we do swap to swap, we give out vapes, but those are obviously agreed and registered vape companies, and there is no illegal substance in those vapes. It's important to state, but also the importance of that relationship and collaborative working with our trading standards colleagues, because although you said it, I think it's really important to stress they are doing a huge amount of work locally and we've had some really good successes, haven't we, because they are actually going in using intelligence and going in to some of, because there is still underage selling in Portsmouth, and they are confiscating and they are taking action on those premises. So there's a lot of that work, but I think what we're saying, what Amanda's saying is you've got to do, there's not one silver bullet for this, you've got to do many things, going in schools, working with children, young people, also with the trading standards, but also with the work that we're doing around working with the the Tobacco and Vapes Bill. It's getting the opportunity at every level, to whether it's legislation, whether it's working with schools, whether it's working with young people. You've got to do the whole thing, and that's the only way we've got to keep driving. And it is having impact and effect, because across the country and locally, because we are seeing a drive down in some areas of smoking, but we've got to keep that going and then keep using the intelligence we're getting to refocus where do we need to work and it is very much with children and young people at the moment. There's been a huge amount of successful work with pregnant women, and again we can see that because we used to see much higher rates of smoking in pregnancy. That's had a huge impact. So it's driving it on, but it is difficult because we are dealing with, I suppose, I'm going to have to be careful what I say, but the tobacco industry, who actually own most of the vape companies, who are still very successfully marketing. And there's been quite a lot of international challenge recently about vaping and vapes, so got to keep working with it. And I think there's a big focus, which will be in the bill, on doing what we've done around tobacco into vapes, particularly on children and young people, and not marketing flavours and bright colours, because they say, you know, we know it's illegal to sell underage, and they say that they're not marketing children and young people, but clearly they are. Yeah.
Thanks, Helen. Thanks. Oh, Ron.
The progress over the last 15 years has been incredible when you look at it, you know, sort of just the impact overall. Trying to stop or trying to deal with that emerging vaping issue, you know, sort of as been described, is, you know, big challenge. But there is still a residual issue, I think, in terms of then established groups as identified in the report in terms of people with long-term mental illness. And in that, we seem to have hit a plateau in many respects. And when I look at it in the hospital setting in that respect, I think it's actually creeping up again in that sense. And part of the reason for that is actually then the attitude perhaps within some of our professionals. We still have a significant number of medical staff and nursing smoking. And their influence in that respect and their willingness to try and stop or prevent and encourage has diminished, I think, a little. So we have a residual issue there. We've plateaued, and I'm not quite sure how we get through it, because part of it, I think, is engaging in a different way. Professionals who know of all of the issues and yet smoke themselves and are therefore supportive of. And outside each of our hospitals, I know where the smoking takes place, and it seems to be increasing.
Yeah, that's absolutely right. And you know, a while ago, Ash did a very damning report on what happens with staff in mental health settings. And not only were the staff level of prevalence around smoking really high, but also it turns out that they were a barrier to getting their patients, their clients, support, because they felt that it wasn't their priority, when actually it really was their priority and gave them that kind of ability to take control of something in their life, where other things might have been more difficult for them. But absolutely, and I think that's, again, it's, somebody had mentioned that level of motivation, the intrinsic and extrinsic motivation. It's the intrinsic motivators for staff to really want to engage with the support that we can provide, that public health can provide around the training and around the resources and around the pathways for engagement. And that is absolutely available for them to access. But I do understand it's not easy. You know, there's so much more work and there's so much less people in the system to do this. But ultimately, it's the way that we want to go. It's a direction that we need to continue pushing in, no matter what barriers. Otherwise, we'll never affect that cultural change around it.
Really quickly because I completely agree, one of the most frustrating things is there is actually, and it's an NHSC must do, all NHS sites should be smoke free. Yet, as you say, you walk in and it's really interesting, how do you actually manage that? It's a really big challenge for the acute trust, for the community trust.
Thank you, and thank you, Amanda, for that. And I've been to, I think, all of the alliances so far, certainly a couple of them, and they're extremely well attended. There's loads of organisations in the room, including the NHS, of course, and yeah, I think it is one of those things about. I suppose it's a culture thing, isn't it? It's getting back to that culture and the change. And I think for all of us, it's because, you know, smoking is something that has all the consequences as well, because of course it's all the other health consequences that come out of it, as well as obviously it's an addiction. So so this is a really important part. We are obviously this is something that we do get that extra funding from the governments, and it is a priority for governments of whatever party, but it is. I mean, started under the last one, the funding, and it was carried on with this one. So it is something we have to make the most of, and I have to say, by the work that's going on, by the results we are getting in this city, I think it is shown that we are making good use of those resources. But we've still got a long way to go, and again, it's about collaboration, and it's also about, as Ron was mentioning, about culture change as well, and about how we can be creative. And I think one of the things that's come out of the alliances has been the creativity as well. And we had a really good presentation at the last one, which was around children and about what not to do. Not to kind of come up with adult solutions for children, because they'll just ignore them. And it's actually how can you work with children, with maybe champions within schools, about what actually is going to work, what's going to make a difference to their peers and to children, to actually get them to not start in the first place. And if they have started smoking or vaping, how can you support them to stop? So it's something that we're working on very well, and sort of Gareth is leading it very well, and yeah, we wish him all the best with his paternity leave with his new daughter.
Yes, thank you. I do actually want to say, just to reiterate, a lot of this work is something that Gareth has led on, so thank you to Gareth Spooner and the Wellbeing Service for the majority of the delivery that they're doing around this. And we're just about to go into Stoptober, so certainly do engage in the comms that are coming out around that.
Absolutely, and and the Wellbeing Service is 10 years old next month.
It is indeed.
And so
yes.
they're going to be doing a bit of a road show, taking it out on the roads and everything, and that they are a really key part of this. Very swiftly on, I know we're running a bit late, so Helen, the Hampshire Isle of Wight Integrated Care Partnership updates, and I'll just say before I start this, I am, as well as being co-chair of this board, I am also the co-chair of the Integrated Care Partnership. So over to you, Helen.
Thank you. It's been a really interesting morning, actually. It's been lovely listening to the reports and lots of common themes. I won't keep people because I know we're running a little bit late, but lots of common themes around digital inclusion, social connectedness, trauma-informed, young people. We dealt with vaping. So lots and lots of common themes there. The report covers our workforce. Sorry, I didn't, did I? Sorry, Helen Coleman. I'm Senior Strategy Manager at the ICB, and I work in the Policy and Information and Partnerships team. And my main role is supporting partnerships and the Integrated Care Partnership. Yeah, sorry, it was just the enthusiasm. So yeah, lots of common themes. And the report has covered workforce and our voluntary sector strategic approach. But I perhaps wanted to particularly highlight, as not in the report, that the Integrated Care Partnership is actually due to be abolished in the NHS plan. And we have our next meeting on the 7th of November, and the members there will be starting to talk about what the future holds. Though it's abolished, the plan says you can make your own local arrangements. Partnership is important. You can make your own local arrangements. So I'm hoping that I'm sure members will be thinking about what that means in relation to the health and wellbeing boards, what that means in relation to other structures. So we have that, and we also have the Integrated Care Partnership Research Assembly coming up on the 19th of November, and there are colleagues coming from Portsmouth, and the focus on that is showcasing research around those ICP priorities, and again should be a really good event. So we're continuing, but when next time I come to do an update, I may have more information about what the future might hold. Thank you.
Lorna.
Yeah, thank you. I just wanted to say that it's really good to see the development of the strategic thinking about the relationship with VCSE and how we're looking at shifting those relationships into a more strategic space from providers to partners. So I think what would be really good is we've got our local Community Wellbeing Alliance coming up in October, and I'd like to take that draft strategy to get some feedback and to get some input from our locally in terms of how that can work, and particularly around how we make sure we've got that voice if the partnership is no longer happening, which is where the HIFGA sit. So I think there's a lot still in terms of how we make sure VCSE have that strategic space to be able to influence.
Yeah, thank you. Very happy to do that. And that is an issue that HIFGA, there is a voluntary sector voice on the ICP. It doesn't have another strategic level voice across Hampshire and the Isle of Wight. So yeah, it's important. So yeah, it'd be really good to have that feedback and discussion.
Great.
I think keeping pace with the changes going on is quite a challenge, to say the least. I mean, for you doing it and for us trying to see it from the outside. There were various announcements made recently about staff reductions within the integrated care boards, etc. And I was going through a rather busy week, and I happened to pick up an item, and I didn't really couldn't find it again, but I thought I saw an item which said that some of the redundancies that were proposed for the ICBs had been postponed because the redundancy costs were seeming to be unsustainable. Is that correct, or have I misread this or misheard something?
Actually, Helen's not here to represent the ICB. Sorry. Is that okay to say? She is here as a manager. I think possibly Linda could answer that question.
I wasn't quite.
No.
You mentioned workforce and stuff, so I thought we could ask questions about that.
Yeah, so there is a workforce plan that would involve reductions, but the current agreement is that it has to come from within the budgets that are already in existence, and so the timeline of those reductions may have to extend. So we're still waiting to hear. So it's been since about May advertised, hasn't it, that we're going to have a 50% reduction, but they've got to work within their financial budgets, and so some of that may well be extended now into next year rather than just this financial year. So it's all still very live. So the staff, unfortunately, are still very much left in a bit of a difficult position.
Thanks, and thank you, Helen, for the report. Obviously, as the co-chair, I was disappointed that what's in the plan, and it's one line. So, as Helen mentioned, there is no information. We don't have any information about timescales or anything like that, or where the statutory function of the Integrated Care Partnership, which is responsible for the Integrated Care Strategy, which of course the ICB then have to, we don't know what's going to happen to that or anything like that, so we haven't got any detail. But we are, as Helen was mentioning, we had a meeting on Monday where we were talking about how we take this forward in terms of making sure that we keep a partnership going and how that fits in with everything. So whether we have it statutory or not, we will make sure that continues. But also just a bit about our assemblies. We're unusual that we have assemblies in Hampshire, Isle of Wight. Virtually nowhere else in the country does. We had a meeting about the upcoming assembly yesterday with Helen and one of our other colleagues, and we've already got 150 people signed up for that assembly, which is absolutely fantastic, and I think that just goes to show how people value what the partnership does. So really appreciate the report, and it does properly reflect about the work we're doing. And it is something that we can that we will make sure that takes forward. But also thanks to Helen and Fran and Ros, who are the people who sort of keep us coordinated and move that across Hampshire, Isle of Wight. And it's really good that we do this, and it really helps us locally be able to coordinate that stuff at Hampshire Isle of Wight level and vice versa, that we can really feed into that at that wider thing, and we can also tell our really good stories about all that collaboration and partnership work we do in Portsmouth, and that can really support things and ideas. So actually what Lorna was saying, I mean, I think a lot of that work that we've been doing over the years in Portsmouth really helps feed into that work that is now feeding in not just through the ICP, but also to the ICB about that relationship with the VCSE as well. So thank you very much, Helen. And Finally, item 12, Roger, verbal update on Health Watch, speaking about things that were in the 10-year plan.
Thank you, Chair. Yeah, so Roger Batterbury, Chairperson, Health Watch Portsmouth. Just going to read a very brief statement out. I've shared it with Anna, so I'll ask her to send that out to members, because I'll read an abridged version. So in the past couple of months, as you know, the government has published both the Penny Dash Review and the NHS 10-year plan, which amongst other plans, as Matt was just saying, and specific to Health Watch, recommends the transferring the functions of Health Watch England to the Department of Health and Social Care and transferring the functions of local Health Watch into integrated care boards and local authorities. The government has said that it accepts this recommendation and will pass legislation to enable it when time allows. This means that until legislation is passed, the DHSC will continue funding the Health Watch function and has advised local authorities to continue commissioning local Health Watch services. The recent media coverage in advance of the publication of the DASH review and the 10-year plan may have given some communities and stakeholders the impression that our closure was taking place with immediate effect. Many local Health Watch have already taken steps to clarify this issue locally. The Health Watch Portsmouth website issued a statement on the 11th of July which says, Health Watch Portsmouth, still here, still listening, which echoed the statement put out by Health Watch England. So the Department of Health and Social Care still needs to clarify when and how any transfer of Health Watch functions will occur. Both Health Watch England and local Health Watch networks will encourage them to answer these questions as soon as possible. In the meantime, Health Watch Portsmouth continues to gather, analyse and communicate people's care experiences to help shape services and provide advice and information to the public. So that's my abridged version. If Anna could send that out to everyone, it's got much more detail on that and to go in the minutes. Thank you very much, Chair.
Thank you, Roger, and I will make no further comment on that due to the fact we are in this pre-election period. If we weren't, I might have some comments on that. Yeah, so and the thing I'll just pick up is as Roger said, just for anyone who doesn't know, local authorities have the responsibility to effectively commission Health Watch locally. And Amanda actually is our person at the in public health who we heard from earlier, and she's actually in charge of that of that function. So that's just about how that fits in and why as local authorities we also are keen to get more updates when they come, as well as obviously Health Watch themselves. So thank you everyone for today. Sorry we went a little bit over time, but I'm sure we appreciate it. It was a really good meeting with lots and lots of good contributions. So thank you so much. Have a good rest of the day.